Hi folks, this is Dr. Rob Cywes. I am the Carb Addiction Doc, and today's video is going to be insightful, but it's also going to be very personal. And I was walking my dog the other day, as I do, and by the way, I apologize. These are my Costco glasses. Somebody left a comment about them, and you know what? Just like Bill Gates, except with slightly less wealth, I don't care what I wear. But you're right. I need better glasses. However, I was walking my dog, and I was being introspective. And I had a very personal introspective moment. And I came up with this statement that I wrote down because I was on that walk that day, I was feeling very fragile. And I realized that a large part of my battle as a human being is the fact that I have to fight my own adequacy every single day. I fight the adequacy battle every single day to justify and validate to myself that I have self-worth. And it is such a common problem. In fact, I would say it's a universal problem with people that have a vulnerability to addictive behavior. You know, and I fight that fight. I recognize it. I've got strategies, and just like the walk of my dog is part of building up my sense of self. Putting the effort in that I can validate to myself that, hey, you did a good job with that walk. Because most days, now that I have an increased awareness of my sense of inadequacy, most days I win. But there are days when I lose. And the resilience to start again each day and to recognize your own sense of inadequacy. And sometimes people are yelling and shouting at me and telling me or making me feel inadequate with their advice. And that's where I have to differentiate. Is that person on my short list of people that I trust, where their advice stings, but I pay attention to it? And it's based upon my relationship with them in terms of trust. Do I trust them implicitly that they're not trying to hurt me, not trying to dissect me, not trying to judge me? But the majority of people out there that say things to me, they're just critics. They're trying to hurt me. Screw them. Screw them. But those few on my list, those few that I can take the risk of being vulnerable with, they matter. They give me good feedback. And the top two of that list is my relationship with a higher power and my dog. And my wife fits into that somewhere. But those walks with my dog are so important. Having said which, this video is about what I call imposter syndrome. And that's just the introduction. You see, and I would urge you to Google this. Google imposter, IMPOSTER syndrome. And I'll read to you what the definition is. Imposter syndrome is a psychological occurrence in which an individual doubts their skills, doubts their talents and accomplishments, and has a persistent internalized fear of being exposed as a fraud. You're wrong. I live in that world completely and utterly. As a surgeon, I'm driven by that. And as someone working in a ketogenic, low-carb, carb addiction space that is juxtaposed by this enormous mountain of experts that keep telling me I'm just wrong, I have imposter syndrome. And the change in me as I've gotten older and as I've matured, and I ask you to reflect on this in your own self, particularly the physicians out there. The challenge for me when I was a young doctor is I was so afraid of being judged. I was so afraid of not measuring up, of being inadequate. And that goes back to how I was raised, my father's desire for me to be successful and setting standards for me that were always higher than I could achieve. And instead of pulling me up and help me to do better, it created a perpetual sense of inadequacy and not being good enough that made me vulnerable to addictive behavior. But in the workspace, as a surgeon, people are watching you all the time. And as a surgeon, your outcomes, if they're not 100% perfect, they're a failure. That surgery is very binary, and bad things happen to people because they're trusting you with their lives. And I'm a damn good surgeon. I'm a damn good surgeon, but I always had that doubt. And the problem early on when I was young was I fought that doubt. I fought people. I was angry at people. I pushed them away because I didn't want them close to me to judge me. It was subconscious. It's not saying I did consciously, but so many doctors, so many young doctors, so many surgeons clashed with the institutions that judge them. And what has happened with healthcare in my generation, in my career, is that healthcare has gone from being an art and a science regulated by physicians and healthcare workers to being taken over as a business in the late 80s, early 90s. And now we use business metrics, objective business metrics, to judge people in an artistic and a scientific world. And it creates the enormous, we already come into this with imposter syndrome, and it just makes things so worse. Doctors are burning out, flaming out, or doctors are subjecting themselves to recipe book medication and recipe book protocols without ever thinking in a healthcare way because they fear that judgment. And here's an algorithm, it's called best practices, and you cannot think outside of that, for fear of being wrong, for fear of being judged. And understand that about your physicians. But it's very, very real. And I'm talking to a lot of doctors out there, because what happens then, if someone reacts aggressively because they themselves feel inadequate, what they look like when they're continuously defending themselves, that's where the concept of narcissism gets placed upon those people. That's where that person becomes the disruptive doctor. That's where we don't want them part of what we're doing. Instead of helping them to understand and build up their sense of adequacy, we keep stomping on them. And I love this line because it pertains so importantly to me, but so importantly to other people. Anger makes you the problem. Anger makes you the problem. And so often, when we feel threatened or judged, we get angry like a wild animal. Or we pull into our own shells, and some people become very mushy. They withdraw, they pull into their own shells, and they display their inadequacy by never participating. And these are brilliant, brilliant people in the workplace. I work in the doctor space, but it works in every space. So let's flip this around, because over time, the beauty of what I've done and the beauty of that fear of what I'm doing is fraudulent has created who I am today in a good way. Because just like my mentor Tim Noakes taught me, always question why. Why? And Tim, he also has imposter syndrome. But look at the great changes he's made because of it. Instead of defending what we're doing and being aggressive out there, I've had to change those ways. That was beaten out of me. And I got hurt terribly because of that. However, having said that, I've questioned the science, the dogma, for 25 years. I've questioned what I've been taught always because it didn't make sense. It didn't make sense. And I've used my imposter syndrome fear of fraud to practice what I believe is absolutely scientifically true. Are we still learning? Absolutely. But I questioned the high carbohydrate diet. I questioned the low fat diet. I questioned the metabolic diseases that they say come from eating fat when people are not eating fat. And every time I had self-doubt, every time I feared that my focus on a low carbohydrate, high fat diet, despite all the experts telling me lipids are bad and you're going to die of a heart attack because you're eating fat, and gallstones come from eating fat, and all these things happen because you eat fat. No, it was sugar. The difference was made in the trenches with me, because every time I doubted that what I was telling patients was correct, they would come in with brilliant results of change. And why were they changing? Because they were defying the high-fat, plant-based advice that they were getting from other doctors, the dogma. So when I doubted this, and I have the intellect to doubt the science of a low-fat diet, the science of a plant-based diet, I had that intellect to doubt it. It factually didn't make sense. But if everybody else is saying that high-fat diet, more plant-based is right, then surely my patients should be doing awfully well if I use my methodology. And the beauty about being right is not because I'm right, but the evidence tells me I am. Every day when I doubt myself, a patient walks in and says, hey, look, I'm not on diabetes medication anymore. Hey, look, I've lost 100 pounds. Hey, look, my cardiovascular disease is better. Hey, look, my blood pressure is better. Hey, look, I'm feeling better. My joint pains have gotten. Every time I doubt what I'm doing, because I really feel like the only soldier in the platoon that's in step. Or maybe my doubt and imposter syndrome says everybody else in the platoon is in step, but you're the one that's out of step. How do we know? We know by the beat of the drum. And the beat of the drum for me are the results that my patients give me. And I know you physicians out there, I know you healthcare workers out there, the majority of you, without recognizing, without owning it, without understanding it, have imposter syndrome. But use it, not to beat yourself up or self-doubt. Use it to look to your patients, look to the people out there for evidence of what you correct. But don't be a victim. Don't go and hide in protocols and algorithms. And I can tell you the healthcare industry, at least certainly driven by physicians rather than the administrators, because the administrators are reinforcing the negativity of imposter syndrome. And we as physicians have to stand together and say, hey, we are good people. We are smart. We can change our minds. We should not fear practicing, not prescribing a statin because you're out of the guidelines. Those guidelines, those erroneous guidelines reinforce imposter syndrome because statins have no value in my mind in human beings. And yet everybody says they should. Can you imagine the doubt that causes in other physicians? So support those physicians, and within ourselves, within our own societies, we should again, as physicians, as healthcare workers, as people practicing medicine, we should take over the business of medicine again, of healthcare. It's not going to happen in my lifetime because there's too much profit to be made. But the layers upon layers of non-medical managerial people, the systems people, are the enemy of me as a human being in this space. And what happens with a lot of our doctors? They get burnt out or they practice inadequate medicine. And who suffers? The patients. Who wins? The profit makers. But we need to start speaking about imposter syndrome. We're just starting to talk about it. And we need to change our approach to protect and bolster and guide our healthcare workers. Because if I wasn't so stomped on, if I wasn't kicked to the side because of my behavior in defense of my own sense of inadequacy, I would have been so different and so much better and climbed so much higher and been so much more effective. It's good that we're starting to recognize it, and this talk is done to accelerate our understanding of the syndrome and recognize that so many people have it, and then develop methodology to support those physicians. Otherwise, we're going to lose them. I hope this has made you think about yourself. Whether you're a physician or not, it doesn't matter. Look at your own sense of adequacy and fight the adequacy battle every day. Do things that reward you with, hey, I'm proud of myself. I'm doing okay. Go for that walk. Do those things that build up your sense of self. Ask the questions, but build up your sense of self. I am the Carb Addiction Doc. Sometimes I ask and answer very, very difficult questions of myself and of you. I hope I've made you think. Please leave comments down below. And if you want a consultation with us, and even if you're a physician struggling with this, we have a large mental health component to our practice. 561-517-0642. Give us a shout.